they have natural immunity?
CDC recommendations suggest that you have both more durable and robust and known immune response if you are vaccinated after you've been previously infected, and those are our recommendations.
Do children 5 to 11 who have recovered from COVID, should they be vaccine exempt?
Our guidance continues to recommend that children who've been previously infected actually get vaccine. Data are emerging on the impact of natural infection in adults. Our data are still even sparser among children.
How does the concentration of antibodies in a recovered COVID-positive patient compare to an individual 6 months after they've had a vaccination?
It really varies from study to study. The one thing that we do know that's very important when you talk about post-infection immunity is that when you vaccinate a person following recovery from infection, the level of antibodies are considerably higher than post-infection alone and higher than vaccination alone. So the best combination of high degree of laboratory-related protectiveness is if a person who gets infected and recovers ultimately gets vaccinated, and that looks like the most powerful of the protective responses.
Clearly, I understand that from the data. My question on whether a COVID-positive recovered patient should be mandated to take a vaccine. If they've not had COVID, then you take a vaccine to boost your immunity level to a certain degree. COVID-positive patients have already done that. And I'm just telling you, it's a hard sale to tell people who have had COVID that they're now under a mandate by the federal government, to be vaccinated. I think you've got an extremely tough sale to a healthcare professional, doctor, nurse, who had COVID, might have a hesitancy about the vaccine. And I look at what ASPR's required to do to fill in for the healthcare vacancies that exist out there and surge people to it. You start doing this to people, Medicare, Medicaid providers, community health centers, we're not going to have the people to surge, Dawn, from the healthcare professionals that make a decision. I had a natural immunity, I've got some protection, but I don't yet believe I need to be vaccinated. I think we need to think about this. Thank you, Chair.